Hi everyone, my name is Harish. Today I'm going to be talking to you about schizophrenia. By now you should have already had a couple of these lectures or case introductions on different topics, and as I said, today we're going to be doing a psychiatric pathology called schizophrenia. So very much in the format of the last case that I went through on COPD, we're going to start off with a very quick introduction, discuss some of the key causes, key triggers of schizophrenia, the presenting symptoms that patients will have, how to investigate it, and then generally how to treat and manage it before kind of briefly considering some key takeaways. Not so much focused on schizophrenia, but just general takeaways from the presentation for medical practice in general. Okay, so obviously the amount of exposure you will have had specifically to mental health conditions in your A-level studies will be relatively more limited. However, you should probably in almost all the different curriculars and exam boards have had exposure to the brain and the brain's role in memory, in thought, in perception, in speech, in a whole host of different cognitive domains and cognitive functions. And even though you might not have studied specific kinds of conditions or illnesses, I'm sure you'll all have a sense that various pathologies of the brain, various diseases of the brain can affect these cognitive functions. So what we're going to do today is kind of build on that, expand that by considering the case of schizophrenia, so that you'll have a sense of what it is prior to the start of your medical studies. And it is something that you'll routinely encounter, especially in your psychiatry placements during your medical studies. So what is schizophrenia? I suppose we should start there. So schizophrenia is a severe mental disorder that involves altered perceptions of reality, that involves disordered thinking, and also social dysfunction. It affects people's social lives, and it really affects all areas of an individual's life. And we'll talk in the next slide about the kind of symptoms that people will have and how that manifests. But before we do so, we'll just consider some of the causes. So there's many different causes of schizophrenia. It's a complex disorder that's produced by a mix of both genetic factors and environmental factors. So there are genetic factors that predispose one or increase the risk or probability of someone developing schizophrenia. For example, if one parent or both parents have the condition, then it raises the probability. It's much more likely that the offspring will have schizophrenia than if both parents didn't have that condition. So there is a genetic link, but there are also environmental factors that can cause or precipitate schizophrenia. So things like childhood trauma, having historic trauma, drug use, like heavy cannabis use in childhood, and then of course there are social triggers, different social events that might cause schizophrenia. Things like bereavement, losing a loved one, having the end of a relationship, or going through a divorce, losing your job. These things can obviously be triggers and precipitate schizophrenia. So what are the key symptoms that a patient will have when they sort of present with schizophrenia? I've broken it down into positive symptoms and negative symptoms, and this is how the symptoms are generally divided between positive and negative symptoms. So positive symptoms, the two main ones really are hallucinations and delusions. So auditory hallucinations, very often patients will report that they're hearing voices. The voices may be persecutory. They may be saying negative things about this person. So they might be hearing voices, and these auditory hallucinations are one of the key symptoms, positive symptoms of schizophrenia. Another one is delusions. So delusions are fixed, firmly held beliefs despite evidence to the contrary. So some of these delusions can be rather bizarre. Some of them again can be persecutory. So some people might have a delusion or a belief that their neighbor has put wires all over their house to record their conversations. So there may be these kinds of beliefs or despite evidence to the contrary, there may be these beliefs about being persecuted, and those would be delusions. So there are these hearing voices, the auditory hallucinations, and then there are the delusions, and they're the positive symptoms. But it's also important to note that schizophrenia can also present with negative symptoms. And these symptoms really, there are a few of them, and I've listed them here with the bullet points. So alogia is sort of the relative lack of speech. So some of these patients won't talk much. They won't say very much. There'll be a reduced quantity of the amount of speech they have. Avolition, so they won't really have goals that they're working towards. There'll be like a lack of motivation to work towards goals, and that's very much linked to anhedonia. They won't find pleasure in activities. So anhedonia is loss of pleasure in activities, and asociality, so they won't interact as much with other people. So you can see here that I mentioned in the last slide that schizophrenia really affects many domains, almost all domains of a person's life, and you should be able to see from these symptoms how that's the case. It affects one's perceptions with how hearing these voices. It affects one's thought and one's beliefs in terms of having the delusions. It affects speech. It affects goals. It affects pleasure. It affects social interaction. So it really is a very severe condition that can affect many, many different areas of a person's life. So how do we go about investigating it? How would a clinician determine that someone has schizophrenia and diagnose them with it? So very often the clinical diagnosis will be based not on some very special test or anything, but rather just on the history and the examination. So you'll take a history from the patient, they'll report some of the symptoms that we've spoken about. You might do like a cognitive exam, and you might again find that, and based on the findings from talking to them and the things that they're reporting and the way they're presenting, you'll most likely make the diagnosis. However, it's important to note that investigations still play a role in ruling out other causes. So for example, you might do a CT scan of the brain, and what that can do is that can rule out structural abnormalities in the brain, abnormalities that might be causing similar symptoms. You want to rule that out. You might do blood tests, because that can help to rule out an infection. And infections can cause, again, psychosis. Infections can cause some of these symptoms that we've spoken about. And it's also important to do a drug screen, because drugs can also be a cause of these symptoms. Drug-induced psychosis is something that's important to rule out. So you might do these investigations like imaging and blood tests in order to rule out other causes. But normally the diagnosis of schizophrenia will be based on taking the history from the patient and doing a sort of a cognitive exam. So how do we treat these patients who have come in or whom we've diagnosed with schizophrenia? So the mainstay of treatment is second-generation antipsychotics, also called atypical antipsychotics. And there's a photograph of risperidone there, and risperidone is a very commonly prescribed second-generation antipsychotic that's used to treat schizophrenia. And how that works is that reduces the amount of dopamine in the brain, because it's thought that excess dopamine is linked to some of the symptoms of schizophrenia. So by sort of blocking dopamine receptors, there is a decrease in the amount of dopamine, and that's thought to alleviate some of these symptoms. So antipsychotics have a role to play. Medication has a role to play. But in addition to medication, it's also important to note that psychotherapy is very important. Things like cognitive behavioral therapy, working with patients, giving therapeutic advice to patients is very important as well. It's not just giving them drugs and medication. It's also therapy has a sort of important role, and it's also important to involve other professionals, for example social workers, to support patients, to support their families as well with some of the broader issues that they may be experiencing. So we spoke about some of the triggers for schizophrenia, and working with other professionals and closely with the patient and family members to resolve those problems is very important in helping the patient overcome the symptoms they are experiencing. So we've come to the end. So what I'll briefly touch on here are just two key takeaways that I'd like you to reflect on and take away, really. So the first is the importance of considering social factors and social triggers when taking histories from patients. Often it's very easy just to focus on the physical illnesses or the complaints they have medically, but it's also important to consider some of these social factors, things like their relationship, things like their job, things like any trauma they may have experienced. Social factors and social triggers are very important to consider whenever talking to patients, not just in psychiatric settings, but also more generally in other in other sort of domains of medicine as well. And the second thing I'd want you to take away is the importance of non-pharmacological treatment in medicine. So I briefly touched on this in the previous slide. Although medication has a key role to play, it's also important to consider things like therapy, like involving other professionals, other forms of interventions, not just medication, that can help to improve a patient's quality of life. So that brings us to the end of this presentation on schizophrenia. Hopefully you found it helpful, you found it useful, it stimulated your thinking. Of course, don't worry too much about going in depth on this, because it's something you will definitely encounter again in your medical studies. But hopefully it's been a helpful introduction to this topic. Thank you very much for listening.